Good morning, everybody. It's still morning. I'm excited to be here virtually today. I do a lot of virtual in my work, so I'm just thrilled that we could still hold the conference today. And I'm excited that Porto Charities and the Arlington Catholic Diocese is continuing to host conferences like this to give resources to families and schools and people in general. So I can tell you a little bit about myself and get started on our topic. I am a clinical psychologist and a licensed behavior analyst in Virginia, and I own Behavioral Directions. We have been open for 23 years in the Northern Virginia area, and we serve individuals with developmental disorders, autism, ADHD, genetic disorders, and such. And we support school districts and our clients who are in schools, including schools in the Arlington Diocese. And we use evidence-based interventions, not so much diagnostic stuff, but really we're on the intervention side, working with schools and families for skill development, addressing problem behaviors, and we really love what we do. So I have a small team, and we have an ABA or a behavior analysis clinic also in Sterling, where our main office is. So pretty much focused in Northern Virginia. So today I'll be speaking on the role of social connections in mental health and self-esteem. So I am really excited to be talking to you about this topic. So let's get started. Let's see if I can advance the slides. Let me see, Carmen. Looks like I'm having, there we go. Okay, there we go. So I'll start off with an overview, and I did notice, I loved Mark's keynote this morning, and I noticed some similarities in what he presented and what I'll be presenting. I don't think a lot of overlap, but I think a nice dovetailing of information. So he mentioned the population or the individuals with developmental disabilities or a vulnerable population and can be at more risk for mental health concerns. And so I couldn't agree more with that. And that is actually one of my starting points is there's a higher risk and we need to think about it. I love that the conference this year is focused on mental health and well-being, and it's such a great one. I think about the individuals we serve. We do serve a great deal of individuals with autism, and some of the social challenges that we see can certainly lead to things like frustration, low self-esteem. We're going to talk about loneliness, bullying, even things like trauma. And so we'll be talking more about that. So what I'll propose today is that the social environment for the person and the social environment having a positive influence from their peer group in school, out of school, is a protective factor against some mental health conditions. And so we will want to take a deeper dive into that. So along with what Mark said, I will share that my data show the same thing, that post-pandemic in general, children are in a much greater mental health crisis. Mark talked about a fourfold increase, and you can see my numbers. And those are not necessarily for those with developmental disorders. Mark gave those data, and I love seeing that too. And it does look like they're higher, and I would agree. We've seen an increase in emergency visits for mental health, and that's CDC data. So it's something for us to certainly pay attention to. So right after the pandemic, I was speaking with one of our diocesan high school counselors, and he said, and me talking to him about kind of a general need for a student, not an alarming mental health crisis. And he said, well, just overall, we're seeing an alarming increase in teens struggling emotionally and academically post-COVID. And we're just overwhelmed with the need. And that really struck me. I'm already a mental health professional, but hearing it from him saying, we can't even keep up was really scary to hear. And so let's pay attention to that. So going a little bit more in particular to developmental disabilities, there was a 2019 research study that showed that children with autism have a higher incidence. We know there are those social communication delays and ritualized behaviors, some restricted interests that pose or end up serving as social barriers for that population. I'll talk about this in terms of autism as just one manifestation of some of the things we're seeing. Of course, we're talking today about all of those areas that might impact the learners that we serve, that we are all invested in here in this conference. I'll also point out that we need to be thinking about the peer group there's a lot of misinformation and misunderstanding amongst kids in general about what developmental disorders, autism, Down syndrome, other genetic disorders are. And so that can translate into a negative attitude and certainly impact inclusion. So we're looking at how we can accept the whole person and have that whole person be embraced, seamlessly included in the environment where they are, whether it's schools. I'm heavily focused on schools and communities, and of course, adults and workplaces too. So we want to look at those strengths and their needs as unique and also valuable in what they bring to the environment. So what are we talking about in terms of special populations? What I'm talking about today, because in our focus would be autism spectrum disorders, genetic disorders, a range, of course, ADHD, learning and intellectual disorders, and then even sometimes anxiety and depression that aren't related to developmental disorders that we see in the population that we serve that need support to help them be included and to be looking at the mental health factors for them. This morning, Mark talked about inclusion and belonging in those terms, and I love that. I wrote that down and really love that. And I guess I'll make a distinction here between inclusion and integration, with inclusion being a higher level. And I loved his distinction between even belonging is better. But here I'll talk about inclusion as different than integration. And we hear those terms being tossed out, talk about school now, but workplace too. So we realize that integration, which is people being together, physically together, maybe, that's not the same as real inclusion. And we need to educate people about that. So true participation, helping everyone feel welcome, valued, and sharing the same environment also is our goal. And so better inclusion will need to involve that we accept and embrace differences, that we participate together, achievement is prioritized, and separation is not the goal, right? We prevent a child being separated and adult too. So I like to use the word stakeholders when I talk about inclusion. And those are the individuals invested as maybe change agents in the process. And we all have a role. I bet there's someone from every category here represented. I'll start with parents and siblings, an important stakeholder in the inclusion process. We have school staff all the way up to the administration and down to teaching assistants and related service providers or people that do specials, those teachers too. School peers, neighborhood peers, peers in other places, because we encourage our clients to expand beyond school, to have a range of peer options for their child. Any club, sport, best buddies, peer mentors, non-school clubs and events, all of those. Extended family, right? Those are stakeholders. Sometimes they're challenging stakeholders where they might not understand or think the child's spoiled, or if the parents are even following maybe a behavioral protocol we gave them, maybe extended family don't buy in and don't follow that. So there are people we need to involve. The church family, if there's a church family, we want there to be a church family. But if the person has that, we would want them to embrace it and to be included. And then mental health and related professionals like me, that we're part of the stakeholder process of maybe helping with a gap if there's one between school and support from school and parents and what they would like to see and where the child is, as well as thinking about what the child's mental health needs are. So we all can influence, going back to social connections, all of these stakeholders can influence the social connections that are needed to protect mental health. Okay, in the description of the presentation that I submitted, I talked about a point of having more positive than negative social connections. And as a behavior analyst, I think about that too. Like if that ratio is really off kilter, then we're going to be tilting into a negative process for self-esteem and mental health. So we need to think about, is the person experiencing a higher percentage, let's say a greater, almost 100% percentage of positive social interactions in their environment than negative? And this comes from, it's cultivated, right? It's things that they experience at home, at school, in the community. We want to protect and promote that higher ratio for self-esteem, for positive well-being. And these are things that the culture sustains. So I'm going to, again, use now another term, is we're going to start talking about culture of the environment. And another part, there's kind of three parts, and the rest of my presentation will maybe outline it that way, is if we're looking at developing good social connections as a pathway to better inclusion, and I think that there's so much evidence for that, it just really goes unsaid at this point, is how can we do that? And one is the culture of the environment. And maybe I'll say school with really most of the ages that we work with. And there's a big focus, I think, on the school culture is that, and then the skills of the individual, and then what the parent's role can be, as well as advocacy of other stakeholders. So let's get started along those that line of thinking while I start off with defining self-esteem. I think we all know what self-esteem is from just common lay terminology, but let's just make sure we're on the same page with this. I would define it as how an individual perceives and values themselves through their social and academic performance. Now, there's global self-esteem that relates to their confidence in things that are non-academic. So as I said, like your self-esteem can come from your social performance as well as your academic performance, but there's a big part that's not this non-academic performance that can relate to bolstering your self-esteem. We know that those we serve, right, the individuals with developmental disorders, also vary in how they're aware of their self-esteem. And I would think about the idea of, I think there was someone already introduced the topic of theory of mind, like how much you're aware internally of your self-perception and maybe what the other person's perception is of you. And this takes internal reflection and cognition, and some of the people that we support are not as aware of that. But there is still an internalizing and an awareness of, am I accepted? Am I liked? Am I valued? Or am I having negative experiences? And that's for everyone. People with a healthy self-esteem know they're valued. They can list their positive qualities, right? I'm a good friend, I'm honest, I'm funny. Low self-esteem might translate into being shy. People might say, oh, not motivated, they're anxious, they think that they can't do it. And you might start hearing these negative statements, self-statements. And this is where it can start going into depression, for example. Individuals could start seeing themselves as just in general not capable. They doubt their skills, negative about the future, and now they're turning into a path that's more vulnerable for them to develop mental health problems. And there can be long-term effects to this, right? Like social discrimination can start to occur. And I love this way of putting it, that sometimes micro and macro aggressions can occur, and we have to be aware of it. This is not a positive thing at all. But to think about how it could be daily small things that chip away, and it's not the person being hit like aggressively, but things that are still aggressive towards the person, subtle and repetitive, in the hall, on the bus, in the classroom, at a school social event. Want to give the example of a family that we serve, and the daughter, the older sister was in the hallway, and it's exiting, dismissal at school, and she's walking to the bus and he's walking to the bus, and they happen to get close to each other. And, I don't know if he saw her, but anyway, she overheard a peer saying, don't talk to him, when a little boy was talking to our client. Don't talk to him. Starting that kind of queen bee, like, it's not cool to talk to him. Another example about a Best Buddies Club that I had personal experience with, or I should say professional experience with, is one of our clients who joined Best Buddies in a public school at the high school level, and there were 0 volunteers. So homecoming came up, and the parent brought up to me, I want my child to participate like we all do, but I don't really know how to do that. And I said, isn't he in Best Buddies? What about Best Buddies? She said, there's no one who volunteered. And so no one's facilitating any alternative plan or just any homecoming plans. And I said, well, maybe you'll have to initiate it. And she said, well, how will I do that? Should I invite another person that he, was maybe friends with, to go out to dinner first and then drop them off at the dance? But she said, but I don't want to put anybody out. So that's telling me we have a culture issue here with that school. or at least with that club, right? And the facilitator. Same thing can happen with getting included in sports and other out of school events. What are those barriers that might lead to some poor self-esteem or lack of inclusion even? We're thinking about this individual that got very overwhelmed with the noise on the bus and the amount of social interaction that was casual on the bus, appropriate, but just overwhelming to the person. Was the coach an advocate? Can there be a arranged special transportation where, parent drops them off, or like, would that be exclusionary? So thinking about things like this, but yet at the same time, what are those even micro level interactions that can start leading to low self-esteem that we want to be aware of? So let's go right into the first factor, which has to do with culture of the school, if the person's school age, culture of the school. And I could even think about college with this, right? So the culture of inclusion is not a given. But what I mean to say is that it should be happening in all locations. It should be happening in extracurriculars, inside the school, all the time, right? Football games, dances, always. And what I see for the Arlington Diocesan schools is I see beautiful things happening. I see the value of the school itself. The mission statement of the school already promotes dignity of life as a value. It promotes culture of inclusion. The culture is it's expected, it's positive, it's cool, and the staff model it. And I know that sounds ideal. I think the diocesan schools are getting much closer to that, if not there in many cases. And I don't see it all the time across schools. And we need a bigger, like, cast a wider net than that. But it gets promoted through administration and down to teachers and all of the staff and all of the parents. And I would say with written policies and a curriculum in place, we need that level of commitment to it. And then we also need a part that is, how do we identify discrimination, those microaggressions or macroaggressions, and respond to it? So that's all part of the policy part and the procedures of the school. What are we going to do? How do we embrace this? How do we value it? And how do we make sure we uphold it? And when we see discrimination happening, what do we do about it? So I'm always, as a behavior analyst, I'm always noticing and observing. And when I go into a school, I'm looking at bulletin boards and I'm noticing and I'm picking up culture from the beginning. And this is a flyer, a poster in an inclusive classroom, elementary classroom. And I said to the teacher, "Can I take a picture? I love it." And I want to reinforce her and say, "Your culture is awesome, right? Your culture is awesome." And because this is a visual message, and I hope it's reinforced by the teacher verbally in every moment, right? That presents itself, as well as all the way through the administration. But this is a sign of culture that we might not all be, best buddies, but we're going to notice everybody. We're going to cheer for everybody. We're going to be kind to everybody. And that's a value, and that tells me about culture. So when we say we're in it together, we're all thinking about how we can reduce those experiences of exclusion and discrimination we know can be daily. And we think about what's our role as a stakeholder. Am I a parent? Am I a teacher? Am I a school counselor? Am I the principal? Am I, whoever else, right? And I'm going to go down to, am I the person, right, being supported? And so I would say, when we're inspired by the divine, right, we cooperate with that, right, that Holy Spirit, and collaborate together so that together we thrive as a community. And I think Mark used the word flourishing, and I said, like, I love how our slides intertwine like that. But how do we thrive together? And I would see it as, this is our contract with society. And we fail to see, we need to make it clear that there are benefits to everybody. There's benefits to the person we're supporting. There's benefits to the teacher who can use those skills with other individuals. We see it with peers for sure. We see it across the board that this is a beneficial thing to do. This book I bought years ago called Perfect Targets, and I really love it. It hasn't even been revised and reissued. It's just a really good book, but you can see its data because it talks about Asperger's. And now we know Asperger's, we conceptualize that more as a continuum of autism. And so you may be hearing more about the social emotional learning curriculum that schools are doing, talking about people of different ethnicities and acceptance and discrimination. and those kinds of things. And they're all fantastic. I can't support them more. You might think about it as a hidden curriculum, that it needs to be made explicit and taught to students. And this really applies to the children and teens and adults that we're talking about today, right? With the intellectual and developmental delays, is we need to develop a healthy mindset. And so this book kind of goes into the idea that, for example, this is written about autism, and a person with autism already has social communication delays is not really the person we should expect to be advocating for themselves and solving the problem if they're being bullied. And an example I would give is a few years ago, I was in a school and the teacher said, there's a real issue at lunch. The kids at the table keep pouring their milk on top of this child with autism's pizza. And they're all laughing. And now the child's laughing too, because I'm finally getting included and missing the clues that he's actually being bullied, but thinks it's just funny. So they're all laughing together, but really he's being bullied in the process. And that's kind of the theme too, is that there's a role for school administrators, let's say in this case, cafeteria monitors and other people, other stakeholders, to address that part too, so that we can protect and develop skills and of course increase empathy for other people in the school, including those peers. So another thing, take a picture, right? This was in the office. So I kept wondering, why is it in the office? Because it seemed like this would be a sign of culture for peers to read. What's your reputation? But I really think this is directed to students, right? It's, what's your reputation? Is it a positive reputation? Are you helping others? Are you supporting? Are you praising? Are you sharing? Are you teasing? Are you leaving somebody out? And I thought, okay, this is good that we take time to print something and post something, and hopefully we carry it through, into the culture further than that. So I was able to also do an interview with a best buddy in one of the diocesan high schools and asked a couple questions to see what I would get. And I was really inspired by these answers. I really, really love the Best Buddies programs that I'm seeing. I really think they're such a model. So one question I asked was, how do you like to support your best buddy and the buddies or the other buddies at school? And I heard, I like to hang out with them outside of school to create a real friendship with them versus just an in-school connection that can seem forced or planned by the school. Okay, all right. And then what advice would you give to schools to include all students? And this person had a lot to say. Here I'm vigorously writing it down. It's better to have students with disabilities treated the same as any other student and to be in the same classes and activities and get to go to and do everything other students can do at school, such as being at lunch, in classes, at school events, unless it would be too loud or overwhelming for them. I love that sensitivity. This is better than keeping them separated, they said. This helps them feel like they belong versus being in a separate place. So another reference location. It also shows real inclusion versus calling it inclusion when it's not really happening in a natural way. If we're all together, we can create a natural bond. I love it. I love it. I love it. So I'm going to go a little bit more specifically to the teacher role. And there are some things that teachers can do to facilitate social connections that are protective for those individuals in their classes with special needs. So one would be to actively facilitate social interactions during academic, like partners, or non-academic times. And there's plenty of both in a school day. And then to create and organize modified work, probably with a curriculum specialist. Some activities are modified on the spot by the teacher. And then there's a feedback loop. Was this too hard? Was it similar to what the rest of the class is doing? What's my organizational system for keeping work modified and aligned so that either I can pull it for the student or the aide can pull it for the student. And if there's an assistant or an aide, to give direction and feedback to the aide, to take charge of that in your class. And I would always say, be strategic on your peer pairings, your groupings, and look at where you're placing the child's desk. Is it separated? Who's it next to? A lot of factors when you think about desk placement. So there's a lot of words on this next slide. I want you to have take-home action steps as a real point of my presentation today. So here are some other pointers in terms of making classrooms more inclusive. The student is following the directives from a whole small group or individual work that's being given. So get out your materials, line up, raising your hand, and then the same cues that the rest of the class is using. I'm making a connection. I need the bathroom. We're doing all the same things everybody else is doing. And the teacher's looking for those signs too from that person. If the person has different materials, the directive can sound something like, everybody, take out your language arts book. Billy, take out your science work in the yellow folder. And I should say, you know what, that content should be aligned. Like, take out your science textbook. Billy, take out your science work in your yellow folder, knowing that it's modified, but we're aligning it. The teacher can also do proximity checks, and we talk about rotate around, rotate to the student in each class to fine tune the work. And to keep in mind, what is Billy doing? Because when I present the next thing, I'll be able to call on Billy to say, Billy, what are you, stand up and show us your whatever it is, something about the sun's energy, but there's a modified lesson, and that's a way to include, and then to praise and to make that, show that value to the rest of the class. Multisensory learning, wherever possible, is presented with manipulatives. I love dry erase boards where we can modify on the spot something that's needed. And then to have a prompt hierarchy. And I love the phrase prompt hierarchy, because here it is helping us to know as teaching staff when we're going to introduce the next prompt. And it's not verbal prompt, is helping the person give time to wait or give time to process and learn, but knowing when the next prompt should be so that it's efficient. Okay, let me speed up a little bit and make sure I'm getting to everything. On the teaching assistant role, we're going to facilitate the work in large group directions, right? I'm a facilitator. I'm going to use the success tools that are provided to me. These are sometimes the role we play is helping teams outline a visual schedule, a token board, a pacing strap. And that could be to help pacing strip to give how much more language, organizing language, producing language in a way that facilitates that. Getting guidance on work or behavior. And then maybe providing slight in the moment modifications when I send my staff into schools as a support person, then they know that their job is not to modify the work, but they can help in the moment with modifications, right? Like kind of stay in your lane, but there should be a role for someone else that helps with that, but they're providing some slight maybe modifications in the moment. And then helping the child give some extra practice moments where there's wait periods, and then following that hierarchy of prompts. Okay, so what I just talked about was the school culture from the top down in the school, and how policies and procedures and training and all of that helps as an inclusive direction. And then now what I'm going to talk about is the person with a developmental disability. What can they do? What's their part in creating better social connections and inclusion for their mental health benefit, right? One thing we think about, but actually it's really about direct teaching. So let's help that person develop the skills that they need to be in those inclusive settings as much as we can, right? So direct teaching, helping the person understand nuances in social interaction. So a recent example was a child with autism who got very upset thinking that a classroom rule was being broken because at recess kids were like pushing, and it was actually appropriate. It was like a social play thing. It was like wasn't anything really off kilter. And the person's black and white thinking made them very upset that a rule was being broken. So we're sometimes missing, right, in terms of the nature of the disability, the nuances in helping them to think about how they should be perceiving situations. Emotional regulation is something that has to be addressed. If there are any interfering problem behaviors coming up, it is a real clear, very clear barrier, and it has to be addressed with helping with developing replacement skills, must be addressed in a really good therapeutic way. Entering conversation, timing of entering the conversation, innuendos, missing the point. Sometimes the people that we serve, had been working with a middle school girl who in the middle of a play date started talking about something she learned in family life about STDs. And she just brought it up out of the blue, and everyone got completely silent and thought, this is strange. And it was one of those negative experiences. And she thought, what did I do? I was trying to bring up something that we talked about in class and just missed. It was just a mismatch, and it ended up being a negative. And the parent kind of facilitated and kind of moved it on, and came back to me and said that was a negative. And so we're just trying to increase those positives. Okay, again, we talked about problem behaviors. This was a flow chart that I, along with a teacher, developed for a kindergarten student who was pushing peers, can use verbal language, but prefers to push and get attention like that, and wasn't really learning the interaction skills very well. So we created a flow chart here where walk over to your friend, say hi, you want to play, your friend will be happy. Push your friend, hit your friend might be sad or scared. And then maybe your friend won't want to play, or your friend might feel bored. So a social script to try to help them, or maybe more of a flow chart to help them understand those things. And then we should target these skills in our plans, IEPs or a 504 or a student assistance plan. And I see these as two areas. I see these as accommodating, like closing the gap by scaffolding, adding a tool or a strategy or extended time or preferential seating, and all of those accommodations that kind of bridge the gap. And that's different than remediate. So we see both sides: accommodate, it's like an antecedent, kind of remediate, teach the skill. And both of them, you have to make it concrete, lots of practice. And with that, and for that, you need evidence-based intervention. And not only that, not only do you need to have a research-based, like effective intervention, but you need time and a commitment and resources, money, time, all of this to make that happen. It's certainly no small order. I think all of you know that. But I'm such an advocate of the science and the methods of applied behavior analysis. It's my field, and it's so highly effective. And it's families often have to access it privately, or it can be embedded, with some of these tools. And hopefully we're sharing that out in general. And we want to track the outcome, right? We want to make sure that the child's learning and it's developing. But the reality is, when you teach these skills and you really focus on those, you might still have a person that is still struggling with mental health. And along those lines, we're going to have to address it. So this is a data sheet that I created with a community summer camp staff to track what was happening. And we proactively talked about, these are things that this child might do. Let's stay on track with it. But here's what you would do if you see this, And so some advanced training to help with inclusion. And then we've got the part of the peers. And peers maybe not understanding what's happening, right? Peers thinking things the behaviors are weird, the behaviors are not friendly. This is a risk factor. And so I'll tell you, and I'll go down to the last point for a second because it's so important, is that peers can serve as anti-discrimination agents. They have a powerful role, but it can flip the other way. They can be a form of discrimination. Promoting discrimination, as I gave you the example of the hallway going to the bus. But they can, with the right training and education, they can be a great anti-discrimination agent, right? For the people that we work with. So we want to incorporate them. And there's some clear research that shows that manualized programs for peer education are effective. And I want to tell you about one, and it's focused on autism. I'm sure there are others. This is put out by the Organization for Autism Research, and it's free. And it's a kit called What's Up with Nick. And they have it by levels of, how do you talk to a kindergarten or first grade class? How do you talk to a fourth or fifth grade class? And it's videos and a booklet, and some on the lower end is like a coloring activity. Higher end, it's more discussion based. And that's one of the visuals from the system. I would encourage you to look at their website. It's researchautism.org. And it talks about how you can help peers understand, and the earlier the better, so that it's not this alienation. I think Mark also talked about that, or someone talked about that this morning, is people being uncomfortable about to just talk and interact, not wanting to offend a person with a disability, and starting at that really early elementary age, that we're all in the same class. What's the big deal, right? Let's all get to know each other. There's a parent role, and this has a lot on it also. Again, some action steps is what can the parent's role be in promoting self-esteem and inclusion? And I would say to make sure you're having enjoyable time together as a family with your child. Accept your child's disability. Highlight their achievements and don't forget about their character traits because you will see those. You're kind, you're funny, right? You're generous. And keep highlighting that. Say it in front of them to others. Help them keep hearing that about themselves. And create opportunities for tasks that they can do and use positive reinforcement to boost their confidence. Sometimes we need to bridge learning skills that are hard with positive reinforcement because it's just really hard to learn the skill. And so we need an incentive like we all do, right? We're going to work and we're getting a check and, we do something and we're looking for that praise or compliment from our spouse. And it applies also. And so you're going to teach also problem solving skills. How do you handle dilemmas, stressors, or negative interactions? You're helping your child with that. I talk about practice and role play, learning conversation starters, and using social scripts to teach your child how to enter a conversation appropriately. You might have to get professional help, and that's okay. Don't shy away from that. Therapeutically, sometimes, especially with problem behaviors, we're going to need to look at that. So we're nearing down here, coming to the end, but I want to give you a little bit more on the parent side. Parents can advocate and collaborate with the school. We know, obviously, they can do that. It's a problem-solving process. It has to happen. We're in it together. And you can also help your child with some phrases and actions if they're being bullied at school, which again is a micro or macro aggression, is how can you help your child maintain their power? Maybe it's not engaging. Maybe it's telling the staff. Maybe it's not always telling the staff. Maybe that can lead to even more bullying. There is a place for it. I'm not saying that it's not, but sometimes teaching your child to say, what, really? Stomp your foot and turn around and walk the other direction is a way to maintain your power when someone's trying to bully you. Extended family, I mentioned before. When we introduced behavior support plans for families, we look at that too. When there's relatives in the home, does the plan fall apart or is it supported? Or what role is the family getting? Some respite or support from extended family? And or are they therapeutically interacting with the child too? And we talked about this today earlier, and I think this is such the value of this kind of conference is to encourage the person's self-identity, right? At the root, you're a child of God. What is God's view of me? And to support the right clubs and places your child is and participates outside of school and obviously maybe in school to support that same value and that they're hearing it at home. And then we have the risky environments and the risky people and noticing what to avoid and what are the signs there to protect your child. Okay, so all of that being said, right, all of those stakeholders, all of the stuff with the school culture and the parent role and the child developing the skills, because they have to learn the skills, but we have to have our part in presenting them with the resources to learn the skills. There is still a result of not belonging, right? Still, it might not be happening. And so I'll say that there is psychological distress that happens when we're not belonging. And you can think about this on a discrimination level for other categories, right? For other, like for, racial and different ethnic groups, is when you're separated, there's direct and indirect consequences of that. There's a psychological distress experience that happens. And it can fall under 3 main areas. There's an emotional cost, frustration, anger, depression. Sometimes we hear, my child's not eating. Well, maybe it's a mental health impact, or maybe there's food selectivity because the child has, another need that we need to be addressing, but it might not be. And you may have heard, from the mental health community, irritability is often the way depression shows itself in children. And then hopelessness too, like you'll hear some of those words. There's cognitive costs where there's an increase in negative thinking. That's the self-esteem part, having a negative view of themselves. And then the social costs, right? Those people are segregated, so we miss those gifts. And then there's not as much trust between groups, right? There's conflict. And so there's a cost. There's certainly a cost to the not belonging. Some other parent actions I could share would be to enlist an advocate, and it might be an educational advocate or it could be a mental health advocate, to help with communication. Sometimes we need to have a third party come in with either expertise or just being a third party, a neutral third party to help bridge the gap. Most of the time, that's with what I see is us bringing our skills to the table to point out what is needed and to work in relationship with both sides to help us keep growing in capacity. And then to think about those policies and practices in the school or in the community or the workplace or the group home is what are the policies and procedures or practices that are listed that we can encourage. With your child as parents, look for changes, look for grade changes, more isolation, sleeping a lot more, withdrawing, crying, changes in eating or sleeping, saying things that are concerning. Don't ignore those. Risky behaviors, change, you're looking for changes. And when you see changes, I'm going to say that there's a level of approach to them. So now we're going to go into that mental health side. So the first would be to notice and screen. You start noticing, you want to start screening for, is this at a level of concern? And it might be an early level of concern. Your school counselor can probably help with this, or a social worker. There's some universal screeners just to see, like, is this anxiety at a level that's, really interfering with life? And it could look different in the population of, individuals with developmental disabilities. Next would be to make some environmental changes. And maybe it's not in this exact, like maybe you'll do A and B together. Is can we change up and add some supports in the IEP or the SAP? Can we add in social work hours? Can we modify the environment? Maybe move them out of a peer group that's causing a problem or monitor more in the hallways? How are we handling some of those microaggressions that are occurring? How are we encouraging that? And then thirdly, that even though a lot of therapists, I think the majority of therapists probably aren't trained to work with those with developmental disorders, and it makes it harder. There are some, and we have to be persistent with that because sometimes it's needed and it needs to be modified and adapted, but it's needed. So I know we have a few minutes for questions. I wanted to just kind of do a quick 3-point on takeaways from today to give you a summary. One is that true inclusion, I'll say true belonging and inclusion require a continued process. It's multi-level. It's on the school or the community and other agencies involved, their culture and getting their culture good. There's in skill building, we all help and the person learns the skills that we need and teaching the skills on their side, the parent advocate efforts, and then the professional side that might need to be involved. And that mental health support might be needed. That's okay. It might be needed. And that good social connections are protective for mental health. So, a lot of what we talked about today is how to preserve and increase and just keep that channel going of social connection so that self-esteem can be solid. So, Carmen, that was all I had today. If you have any questions, I'd be happy to hear those. And I have my contact information there. If you on our website, I'll share while people may be writing in questions. We have a lot of training videos, and we also have a newsletter that we put out that usually includes content, sometimes about inclusion, or it's about like getting ready for the holidays and maybe being overwhelmed, with sensory stuff. And we have a lot of stuff on our website that you can certainly look at. And so I put the website there.
Excellent. And Dr. Barbin, is there a way, if let's say we wanted you to come and give a presentation to our child's school or maybe to our colleagues, if we're educators, is that something that we could set up with you?
Yes, it could be. That's our main number.
Okay.
I do presentations and conferences and, really more like direct consultations more than anything is more work on the individual level with families and schools. Some of our staff do go into schools. And like I said, we have a clinic. But yeah, so the website has a way to reach us with a contact form at the top on the homepage and then the phone number there.
Great. Thank you. And we are getting lots of thanks and kudos in the chat. This was really, really amazing. And thank you for all of the resources that you gave us. And we just look forward to, continuing this relationship and, growing the partnership between all of these great presenters that we have in our diocese, because, the resources really are here, and it's amazing that, we can move this forward and just make that positive belonging for all of our students.
That's
So,
awesome. I love supporting the diocese. Somebody asked about the newsletter. It's probably a little tricky, but it says like sign up for our e-newsletter or something. You'll see it on the homepage if you wanted to sign up for that. We promise we don't spam a lot.
actually, what? I have a question, Dr. Barbin. If we have, students who maybe aren't identified or diagnosed as being on the spectrum or having any kind of disability, but we see them struggling, is it appropriate to go ahead and apply these interventions without necessarily knowing? Or, I mean, how does that all play out?
Well, this is a really good question. This has been coming up actually a little bit more recently, I noticed. So we don't do the diagnostics. It's just not an area we offer. And plenty of people do, even though I know their waiting lists do a great job with diagnostics. So we're focused on treatment and intervention. As behavior analysts too, so I have my two hats, right? Clinical psychologists find value in the diagnostic system because it can really give an idea about treatment that might help. And understandability. So I can see that and I love that. And so on the other side, behavior analysts really think about symptoms and treatment and not in a way to bring a person down to it's just a symptom, but we don't require a person to have a certain diagnosis. Does it sometimes help me understand? Yes. Like, is this rigidity about executive functioning, or is this rigidity about anxiety or something else? And if the parent's questioning it a lot, this has come up twice recently where I said, I really think it would be helpful to get a very good psychological eval so I can understand. And then I can, like, the child's not eating. Is it rigid? Is it rigidity with like food textures and selectivity? Sometimes that comes under autism. Or is it something else? Is it depression, for example? So those things I find value in, and I would encourage that. But there are other times that when families contact us, it might impact insurance reimbursement, right? Because there's not a diagnosis to put for them to really submit. But if that's not something of major concern, as long as we can do our behavioral assessment, which involves observations in the school and the home, a parent interview, and some data collecting, we'll have a pretty good idea of what we're having to address, what we need to address.
That's awesome. That's really good to know, because sometimes getting that diagnosis can be really difficult, or, more, you need a solution like right now.
And we'll say, get started. Get started. I mean, you can think about it as a resource issue. Like, if you really need the insurance, you're probably going to have to wait and get that evaluation. But it's heartbreaking when you have like a 3-year-old, family that calls for their 2 or 3-year-old that just got diagnosed. And you say, why don't you wait for 8 months to a year on a list for children's to get a diagnosis? You might as well start now because early intervention is so powerful. So yeah, that's usually our message.
Well, that is wonderful. And thank you so much, Dr. Barbin. We are going to go ahead and close this session so that we can open up for our next session at 12:30. So thank you all for attending, and we are so grateful to all of you and hope to see you at the next session.
Thank you, Carmen.
Bye. Have a good day, everyone.
Okay. Bye-bye.